Most patients actually have their lap band surgery as an outpatient, so they're in and out of the facility within a few hours. If patients have Medicare, though, they do have to have the surgery in a hospital and spend the night, so they're there for about 23 hours. And if there are complications, they may stay longer.
In order to prepare you for the surgery, one of the things that the surgeon will do is ask you to shrink your liver down. This is important because the liver lies over the top of the stomach, and for us as surgeons to be able to get to the top of your stomach where we are going to perform the surgery, we need your liver to be small in order to reduce complications. The liver is the place in the human body that you store sugars and starches. So for about a week or so before the surgery, we either place you on a very low calorie or, in my case, a very low carbohydrate diet to shrink that liver down.
So lap band surgery is done under general anesthesia, which means that the patient is completely asleep, unaware of what's happening and not feeling any pain. The anesthesiologist is completely looking after them while I'm focused on the surgery. We make several small incisions in the abdomen and then place the instruments through the little tubes that go through those incisions. So we use long chopstick-like instruments, and we actually watch what we're doing in the surgery on television screens. So we have a camera attached to a telescope, and that's how we see what we're doing in surgery.
Once we get into the abdominal cavity, we have to identify the stomach, which usually means just moving the liver out the way and finding the stomach. The stomach looks a little like this. And so the goal of the operation then is to take the band, the lap band, which is this device down here, and wrap it around the upper part of the stomach. Once we've wrapped the band around the upper part of the stomach, then most of us will stitch the stomach across the band to hold it in place and prevent what many patients may refer to as a slip. Once we've done that, the band is connected to a tube, and the tube is connected to a button. A button is a little port, and that button is implanted underneath the skin, usually on the left-hand side.
No part of the band is visible or hanging out. And the access port allows us to be able to actually adjust the band. So the whole system is filled with saline or fluid. And in the office, in the follow-up visits, we access the port with a special needle and inject fluid to gradually tighten the band or loosen the band if necessary.
As part of the continuum of the obesity journey, it's about living the rest of your life, and the surgery should not impact negatively on that journey. That's what I like about the lap band, is its simplicity, especially the operation.